Right. Namaste. Welcome to day 3 of the Rajyogi Power of Breath Tridosha Balancing program for Kapha reduction in the respiratory system. So, like we have discussed earlier, it's not as if Kapha is all bad. It is required to lubricate some of the systems in the body. So, it's not all bad. The problem with Kapha is when there is too much of Kapha, especially in the respiratory system, because then that interferes with the breath, with the breathing. Breathing में क्या होता है? It may create like a lining in the lungs, for example, or in the airways. तो इससे जो exchange of gas है उसमें तकलीफ आती है and so on. So therefore, जितना lungs में से respiratory system में से we are able to take away the phlegm, the easier our breathing becomes. So that's why it's important that the lungs are cleared of phlegm and stale air and so on. On the first day, you learned how to do huffing, and it was a powerful technique to throw out as much phlegm that is at least on the surface, so it comes out more easily. Day 2, you learned a couple of things, including how to do complete yogic breath. Complete yogic breath, as we have seen before, is in itself a very powerful method to fill the whole system, the whole lungs with a lot of fresh air. When we fill up the whole lungs with fresh air, it pushes out stale air, number one, and it also starts moving away any phlegm or mucus, etc., that needs to be taken out. So therefore, it plays a very important role in filling up. Also, you learned yesterday a little bit how to do Hanuman master breath, which means to pull your breath or to take your breath up the spine. वो किसका हो रहा है या किसका नहीं हो रहा है, प्लीज लेट मी नो. प्लीज टर्न ऑन योर वीडियो सो आई कैन सी यू. एंड किसका हो रहा है मुझे बताएं. प्लीज टर्न ऑन योर वीडियोस. इट्स गुड टू सी हु वन इज वर्किंग विथ. आज राजकुमार जी नहीं दिख रहे, कल तो उनका बहुत कफ निकल रहा था. या टेल मी किसका हो रहा है वो चैनलिंग ऑफ द ब्रेथ फ्रॉम द टेल बोन अप द स्पाइन. किसका हो रहा है या नहीं हो रहा है? हाँ, कुमकुम जी का हो रहा है. वेरी नाइस. हाँ, एनीबॉडी एल्स? नरपति जी, वंदना जी, प्लीज टर्न ऑन योर वीडियोस, काइंडली ऑन करिए वीडियो. नहीं तो लगता है हम
मेरा भी
टॉकिंग
हो
टू.
रहा है।
आपका हो रहा है, एक्सेलेंट. इससे
हाँ, मैं कर।
इससे जी, इससे होता क्या है, वी स्टार्ट एक्सेसिंग द सुषुम्ना नाड़ी. तो अपन को जब ये सर्दी खांसी और कई तरह की चीजें होती है, लॉट ऑफ द ब्लॉकेजेस आर एक्चुअली अलोंग द सुषुम्ना. हमको लगता है कि नोज ब्लॉक्ड है, मे बी थोड़ा बहुत नोज भी ब्लॉक होता है, बट द रियल इफेक्ट इज इन द सुषुम्ना नाड़ी. The Sushumna Nadi gets blocked. Therefore, when we do some of these techniques, we start working on the Sushumna, the cleansing process begins. और जैसे जैसे सुषुम्ना की क्लेंजिंग होगी, सब ब्रीदिंग में भी इम्पैक्ट आएगा और दूसरे चक्रों पे भी उसका पॉजिटिव इम्पैक्ट आता है. Once again, please, should I call your names individually to ask you to turn on your videos? Rajiv De, please turn on your video. You, Vandana Sareen ji, please turn on your video. Mansi Joshi ji, Gulin ji, please turn on your videos. It's good to see Rachi Bhale ji, Geeta ji, Rashmi Joshi ji. Please turn, Bagla ji, please turn on your videos. It's good to see you. Kalpana Shakya ji, very good, yes. Tell me, what all have you been doing? How much phlegm are you able to expel? Any questions, any doubts, any difficulties so far with anything that you have learned? Kindly. बोलेंगे तब मुझे समझ में आएगा.
Uh,
वीडियोस तो टर्न ऑन जी.
Rajesh, I have two, three questions.
जी.
One, I noticed that I am putting more intensity than required because it leaves me exhausted.
ओके.
And sometimes I get a tendency to get
हेडेक.
a headache, sort of a thing. So, I mean, in order to huff it out or do all that, it's like effort which increases my blood pressure and my heart rate. So,
Yes.
and sometimes I'm not able to hold it for so long, for 4, 5 huffs, like
जी.
that.
जी.
So, I think I should go slow on it,
Hmm.
and I'm
Hmm.
practicing more of belly breathing because that
Okay.
instantly gives me relief.
Very good. So now you have a number of questions built into that, and I will address them. See, belly breathing is excellent because it gets you into the parasympathetic nervous system. In yesterday's session, we discussed how parasympathetic nervous system creates a thing called vasodilation.
Hmm.
I don't know if any of you have been able to look at this word or research this word. Very important word. Vasodilation, for example, when you sit in meditation, a certain amount of vasodilation happens. Whenever you are relaxed, doing a hobby, uh, sitting in a peaceful state, automatically a little bit of vasodilation happens. However, whenever there is any kind of stress, any kind of pressure, any kind of, you know, going into the future, past, that sort of a thing, vasoconstriction may begin to happen. So vasoconstriction causes things like headache, etc., etc. Migraine किसी को होता है तो vasoconstriction है. Almost all the negative things that happen in our body, there is a correlation with vasoconstriction. Almost all. I'm not saying all. So understand these two words, vasoconstriction and vasodilation. तो कुमकुम जी ने भी जो बताया, उनको जो हेडेक होता है vasoconstriction का इफेक्ट हो रहा. Now, in the advanced part of this program, you will learn techniques to do what I call the lotus opening program. A very powerful, very effective program. इससे क्या होता है? With your own attention, with your own breath, you learn to vasodilate. You start creating a vasodilation in your system just with the power of your own breath and attention. You will learn that in the advanced course as we go deeper. When you continue to do that and you are able to vasodilate almost at will, there is a very significant change that happens inside the body. Because, like I just said, most of the good states, good things are connected with vasodilation. Most of the negative states, bimariyan, stress, tension, chinta, sadness, depression, they are all connected with vasoconstriction. Very important. Vasodilation, vasoconstriction. Understand these two words and understand the correlation of these words with other states that we are in, emotionally, mentally, physically, in terms of health, etc. There is a very deep correlation or connection. Good vasodilation, bad vasoconstriction. So when you learn techniques to get into vasodilated states, और मेरे ख्याल से ये आपको और कहीं सुनने को नहीं मिलेगा या सीखने को नहीं मिलेगा. Probably these are some of the courses where you can learn about them, including the little that I do in the Tridosha Balancing. इसमें we don't go 100% deep, but we go quite deep. In fact, I'll be very happy to share with you today that I'm going to launch a program very soon to start sharing vasodilation techniques with expectant mothers, because a lot of mothers, they go through a lot of stress, and when there's stress in their body and they are tensed and they are worried and so on, the vasoconstriction that happens in their system hurts both the baby and the mother. So I'm going to launch a program focused on vasodilation for expectant mothers. So you can share that with your, with your known people so that they can take advantage. So I think that answers your question to some extent,
Yeah.
Mamiji. Okay. Anybody else? Anything
Yeah.
else?
I just wanted to
Ji.
is similar vaso this dilator thing. Arteries तो dilation का है ही है,
Hmm.
but it's the vagus nerve which gets constricted.
Also, yes.
Yeah.
So,
So I have been getting these attacks where I
hmm,
faint because of
hmm.
vagal syncope I had.
Ah, yes, yes, yes. Vasovagal syncope. Yes, yeah.
Yeah.
Ji.
So the
Oh, yes, you'll get very good results in that.
most
Very good
important
results.
thing is to
Hmm.
connect it with the vagus nerve. I mean,
Yes, yes.
understand it with the vagus nerve.
Ji haan. So as you have started doing the Hanuman master breath, you are already connecting with your vagus nerve,
Yeah.
which is the English word for Sushumna. I need to silence my wife. Just give me a moment. Okay, I'm sorry. Yeah, she was doing her yoga. Right. So this is about the vagus nerve, English word for Sushumna Nadi. थोड़ा सा वेरिएशन हो सकता है. They mean it may not be 100% the same, or the idea may not be the same, but largely the same thing. So you will learn the technique. As you are doing the Hanuman master breath, you are already accessing your vagus nerve.
Got it.
In the following days, starting maybe 2 days from now, we may not do the advanced course immediately tomorrow, but maybe from day after tomorrow, so that people have time to sign up and to confirm their participation in the advanced course. So maybe we'll start day after tomorrow. In the advanced course, like I said, accessing the vagus nerve and doing lotus opening. That's the term I use for the vasodilation. Very powerful, very effective, and excellent results you'll get, especially as you go deeper into the program. But anyway, we'll start with that when we do. For now, any questions about whatever we have done so far? Anybody? Any questions?
यस सर.
Yes, yes, Kalpana ji, बोलिए.
यस सर. हाँ, मुझे मुझे एक पूछना है कि जो एडवांस है उसमें हम लोग वात और पित्त ये दोनों पे काम करेंगे.
नहीं नहीं नहीं, अभी काम हम सिर्फ कफ पे कर रहे हैं. फोकस हमारे कफ पे है.
अच्छा, नहीं
बट
एक्चुअली व्हाट हैपन सर, मुझे ना मेरा जो लेफ्ट फेस है उसमें थोड़ा सा प्रॉब्लम है. मीन्स ऐसे लगता है जैसे खींचता जा रहा है. बिफोर 2 इयर्स मुझे थोड़ा सा माइल्ड अटैक हुआ था फेस का.
स्ट्रेस है, माने
तो
आपके
वो
बॉडी में
मेरा,
बहुत स्ट्रेस है.
हाँ,
तो ये जो
तो फिर
हम्म,
ब्रेन का एमआरआई वगैरह सब हो गया था उस वक्त और सारे रिपोर्ट्स नॉर्मल थे. तो वात मेरा बहुत बढ़ा हुआ है. वात का जो है वो बहुत बढ़ा हुआ है. B12 बहुत कम हो गया है. टैबलेट्स में ले रही हूँ B12 के, लेकिन फिर भी एक पीरियड के बाद वो फिर से शुरू हो जाता है. जैसे अभी अभी चल रहा है वो, तो जैसे ऐसे लगता है कि खींच रहा है अंदर से ये लेफ्ट पोर्शन स्लिप.
तो ये
तो
देखिए, दिस
इस
इज
एक्चुअली,
ऑब्वियसली इट इज कनेक्टेड विद स्ट्रेस ऑल्सो. तो जो लोटस ओपनिंग की बात कर रहा हूँ, वेजो डायलेशन की जो बात कर रहा हूँ, विच वी विल स्टार्ट डूइंग इन द
ओके
एडवांस कोर्स, इससे आपको रिलीफ गारंटीड मिलेगा. करते रहना पड़ेगा. देखिए, प्लीज डोंट
ओके.
एक्सपेक्ट ओवरनाइट रिजल्ट्स विद थिंग्स लाइक दिस, बिकॉज
नहीं
सीखने
नहीं.
में कुछ समय लगेगा. उसको उसको अच्छे से करने में थोड़ा और समय लगेगा. रिजल्ट्स विल बी सुपर, सुपर रिजल्ट्स. उसको करिएगा, उसका लाभ उठाइएगा जी. एंड एज यू नो, द एडवांस कोर्स में देर इज अ कंट्रीब्यूशन दैट यू आर एक्सपेक्टेड टू मेक, बट कंपल्सरी नहीं है. ऐसा नहीं कि इफ यू कांट अफोर्ड टू पे यू कैनॉट डू द कोर्स. यू कैन स्टिल डू द कोर्स. इफ यू कैनॉट अफोर्ड टू डू टू मेक एनी कंट्रीब्यूशन, डोंट वरी. The idea is to help people breathe better. So even if you are not able to pay, मेरे को मैसेज भेज दीजिएगा. You can't pay, you are not able to pay, you will get a waiver. जब आपका सुविधा हो तब करिएगा, नहीं हो तो मत भी करिएगा. द आइडिया इज टू डू बैलेंस बोथ थिंग्स. जिनको हेल्प चाहिए उनको हेल्प भी मिलेगी, और जिनको हु आर एबल टू हेल्प टेक द प्रोग्राम फर्दर, इवन बेटर. चलिए, एनीवन एल्स, एनी अदर क्वेश्चन रिलेटेड टू वट एवर वी हैव डन सो फार? Turn on your videos, please. Please turn on your videos. It's good to be able to see who we are talking to. Indu Mami ji, Kullan ji, Shija ji, Gaurav ji, बागला जी. या बागला जी, तो पहले तो डालमिया जी तो ऑन रखते थे आपको. सरोज भाई ऑन नहीं रख रही है. यस. एनीवन एल्स, एनी अदर क्वेश्चन? ओके. तो आपको हफिंग टेक्निक आपका हो रहा है. आपका कंप्लीट योगिक ब्रेथ वाला टेक्निक हो रहा है. नो प्रॉब्लम. Have you been able to do it on your own? Are you able to expel more kapha? फ्लेम निकल रहा है आपका? प्रश्न का उत्तर दें काइंडली. हाउ विल आई नो अदरवाइज? you'll have to unmute जी.
I just cough a little, not
हाँ.
much expulsion is happening.
Okay, so you have been doing some of these techniques for a while, तो काफी हद तक तो निकल भी गया होगा, और थोड़ा बहुत जो है और निकल जाएगा. And then the next part of the program, you will find that the production of kapha is coming down. Again, it will take a little time, but you'll get very good results based on
I,
first hand.
what I have realized, if we do it every day in the morning, whatever is built up is coming out. So it doesn't accumulate in your system.
Yes,
So
exactly.
that helps. Though it has
That
to
helps.
be like you are brushing your teeth every day.
Yes.
You have to practice this.
You have to practice every day. In fact, if you're doing it every day, it doesn't take long. 10
Right.
minutes time you will allocate for this, and you'll be able to cleanse the lungs and so on with ease.
Yeah.
And as your breathing becomes better, as you breathe relatively better and consistently better, it will impact every single area of your life. जीवन के हर क्षेत्र में उसका लाभ मिलेगा आपको. ठीक है, चले आगे, चले.
Yes, sir.
Any questions? जी. Yes, Narpati ji.
Yeah, sir, actually, for me, cough is coming out. It is a bit better now.
It is
So
better.
in the morning, yeah,
Mm.
and I'm doing gargling also.
Mm.
Then after that, cough also is coming out now.
Yes, the more the cough that comes out, better. If the cough is there in the system, it needs to come out. The role of kapha in the respiratory system is not very good. The role of kapha in other parts of the body may be something good, but too much of that, even there, may not be good. In
Yes.
the respiratory system, especially, we need to bring down kapha. So if the cough is coming out, excellent. You will notice that your breathing is getting progressively better. Is that right, Mr. Dhar?
Yes, sir.
Okay. How old are you, if I may ask, Mr. Dhar, if you don't mind?
I'm now 77.
77. Excellent. You seem to be in good health otherwise, but if your breathing improves, you will be in still better health.
Yeah. So
Thank you.
my main issue is that nose blockage.
Yeah.
Nose.
You remember yesterday we discussed, I
Yeah.
said more than the nose blockage, it feels like the nose is blocked, but the actual blockage is in the sushumna. That is where the phlegm is collected in the respiratory system also, and also in the sushumna. So as we continue to work on the respiratory system and the sushumna together, the kapha will come out also. And in the advanced course, you will find that the production of kapha has come down quite significantly in time. Again, do not expect overnight results. Over time, you will get very good results. Fantastic.
But that would be excellent. That
Yes.
would be excellent. But the reduction in production.
Yes, yes. That is the result you will get. As you do get deeper into the advanced course, understand the technique, start practicing them regularly, you'll see those results. The people who did that earlier, people who went through the whole program, they have shared some of their experiences, which I've shared in the group as well. And many of them have reported excellent results. Excellent results they have reported. Any other questions? Shall we go deeper?
सर मुझे पूछने का था कि जो गार्गल करने का है प्लेन वाटर से करने का या सॉल्ट या टर्मरिक पाउडर लेके करने का.
Both. You can add salt also, you can add turmeric powder also, and it should be warm water, and do it regularly. बहुत अच्छा रिजल्ट मिलेगा आपको. सुबह सुबह एक बार कर लीजिए, you will get very good results. अवश्य करिए. Gargling is very important. Anything else? Any other question?
Sir, what is the impact of the steam inhalation? When you
See, personally, doctors recommend steam inhalation.
yeah.
Personally, I am against steam inhalation.
Okay.
Because I have always been doing a little bit of pranayam and pranayam related practices to throw out the phlegm. So what I found was, for example, when I got COVID, etc., and when the doctors were forcing me to take the steam, etc., I actually refused. I said, because every time I did it, I felt worse. See, what is kapha? Kapha is a combination of two tattvas, Prithvi and Jal tattva. These two combine to create kapha in the system. In the rest of the system, I don't worry so much, but in the respiratory system, if there is kapha, it causes trouble. Now, since I have been very aware of my breath, I am a breath watcher and I do stuff with my breath and so on. What I noticed during the COVID time was every time I would take even nebulizer, etc., I wouldn't feel good. I refused outright to the doctors. I said, I'm not taking it. I'm going to continue doing my own breathwork practices and I'm going to heal myself with those. And I did that and I'm very happy I did. because in nebulizer, etc., also they use certain kinds of medicines, steroids, and so on. These
Yeah,
all
straight.
have a, yeah, they all have a negative side effect also. I'm not saying this applies to everybody. Depending on your condition, if your body needs it, please do it. See, I'm not a medical doctor. I will not give medical advice. So
Yes.
anything to do with medicine, medical advice, I stay off that area. That is for the medical doctors to advise,
Yes.
and for the patients to see how much they wish to accept or not accept. Okay. Yeah, Shijaji, you have your hand raised. Tell me, Shijaji.
Yes, yes.
Hmm.
Sir, so the problem is I feel coughing. Okay, it's very extreme, but nothing comes out. In the sense, like I can feel some mucus is there in my path, but
Hmm.
I'm not able to
Yes.
I don't know why that's happening
No,
these
the
days.
reason is sometimes some of this phlegm is very old and it may be somewhere deep in your system. Earlier, we have seen how
Okay.
the lungs, the size of the lungs, surface area of the lungs is equal to a tennis court.
Oh, okay.
So, under में where that the phlegm has collected, how thick that phlegm is, we don't know. So, very often people say, I'm getting a dry cough, I don't have phlegm. But believe me, if the body is trying to cough, cough, that sound, that sensation, that means spasms are happening because the system is trying to throw out something. It is clear to me, it is clear that it is trying to throw out some external or some foreign thing that is in the lungs, which means there is some kind of phlegm. Sometimes that old, very thick kind of phlegm can stay there God knows how long. So when I started getting very, very deep into some of these breathwork techniques, even after continuing for years, suddenly one day I would find that there's something very thick and brown is coming out of my system. And it's come out and it's continued to come out for a long time. Because, like I said, tennis court, that's a huge size. You know, if you open your lungs the size of a tennis court, that's huge. So, what is hiding in which part of your lungs, we don't know. It needs to come out. The more it comes out, the better for us, isn't it?
Okay, okay.
So, if that sensation is there, coughing sensation is there, it's a sign something needs to come out. Okay, anyone else? Any other question? Deepika ji, I think you were trying to say something, were you?
नहीं सर आई गॉट मतलब better
Okay.
yesterday night also.
Hmm.
But today morning I have so much acidity. It has
Hmm.
gone to my head also. Then I had to
Hmm.
take one medicine.
Hmm.
That time I won't able to breathe properly.
Hmm.
It was very heaviness in my chest.
Hmm. Hmm.
Then I did that exercise and some of the spit is coming out basically,
Hmm.
not
Hmm.
abhi mucus more, but spit is coming out.
If it
Then
feels
I felt
sticky,
better.
if it feels sticky and slimy, then it means it is some kind of mucus.
It's whitish, sir.
It may
Whitish
be
spit
whitish.
like
Ah,
normal that bubbles wala that
yeah. Yeah, but
type.
sometimes, we think it is only spit or just water. But if the consistency is
Something
sticky,
is yes, yes,
sticky,
yes,
slippery,
yes,
that means it is mucus.
yes,
Just say
yes.
when we
That,
catch a cold, for example, we
mm.
sometimes water flows from the nose. Initially, it feels only like water, but it has a salty kind of taste. It's a sign that it's some kind of mucus or mucus is being created.
And
Uh,
sir, one thing, whatever we are doing that huffing wala exercise, is say sinus is also melting because I felt today in the morning कि something is coming down
yes,
from
yes,
my head, nose,
yes.
nasal passage,
Ji, ji,
and this area. It
ji.
is coming down. And after
Ji.
so many years, I felt that
Wow, that's
something is
wonderful.
coming out.
So, are you also noticing that your breathing quality, your breath quality is better than it was before? Are you
Yes,
noticing that also? Yeah. So you have to continue doing this because see, sometimes a lot of phlegm, lot of mucus collects in the system, lot of it. And when I say system, it's the lungs, it's the throat, it's the
so
sinuses. It collects over there. Breathing becomes very difficult. And I have gone through this whole process firsthand. And I've been able to win over that. So I'm very clear about what we need to do, how we need to do to take it out of the system. a time will come when you might feel that you have never breathed as well as you are breathing now. It will
And
take a
what
little
is the
bit.
reason? What is
Hmm.
the reason, sir? If I lie down straight, so
Hmm.
always I got a cough. Why?
Yes, yes,
Matlab,
yes. See, because when this kapha collects in the body, especially when we
okay.
lie down, especially when we lie down, it
In a
has a
straight
way.
position.
Yeah, it has a way of
Straight position.
blocking. It has a way of blocking the airways. So therefore, breathing becomes very difficult. Yesterday, you
Yeah.
remember when we were talking about the complete yogic breath. If you
Yes,
do
sir.
15 cycles of that complete yogic breath, even if your nose is very blocked, at least you will be able to sleep reasonably well because you'll be able to breathe better. Because when we are doing the complete yogic breath, it is affect it is acting directly on the sushumna. It helps
I
to
used to
clear.
uh, I used to sleep slanting position में.
That's
I
so
think 4 5
troublesome.
years say I am
Mm,
sleeping after COVID, that
mm,
slanting position. I am not
oh
able
my
to
God.
sleep on one
नहीं
pillow.
नहीं 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 डोंट वरी दीपिका जी यू विल बी फाइन यू विल बी जस्ट फाइन आपको ठीक करेंगे जस्ट स्टे विद दिस प्रोग्राम do the
Yes,
techniques
sir.
that we
I
are
want
sharing.
to.
Oh, you'll see a huge amount of benefit. In fact you will become an inspiration to others. In the earlier program there was a 84-year-old, if I'm not I forget. Kumkum ji, you remember how old Geeta ji is 78 or something, no? Something like about 80 years old. Her oxygen level had come down to 79, 80, so low. And now, after doing the program, midway through the program, she said her oxygen has come to 93. She had to take oxygen every day. Now she doesn't need to take it so much. So, she's in a far better position. If she continues, she'll continue to get very good results. It's there.
I
I've
will
shared it in the
follow.
group.
Yeah, I
Her
have seen
her
that.
report, etc. I've shared that in the group.
Yes,
Yeah.
sir. I have seen that.
And I'm sure in the days ahead, you will also be writing something like this that will inspire others. Geeta ji's story, Shailaja ji's stories, they were earlier participants. They've inspired many people. Similarly, your own experiences will also inspire others. These are very powerful techniques. You'll get very, very good results. Just stay the course. Be regular with the practices. I'm here to guide you. You need any questions answered, any doubts, I'm here to help you with that. And
Okay, thank
see,
you, sir.
I am a Hanuman ji ka bhakt. All these techniques are not my creation.
Hmm.
To me, to me, it is clear that they are a gift from Hanuman ji. They are a gift from Hanuman ji, not for me. They are a gift from Hanumanji for the welfare of as many people as possible. I am nothing. Why do I matter? But if it
You are
helps
very
me,
humble.
no, no, not a
Very
question of
humble,
humble.
very
I
nice.
understand. I understand that I am nothing. It's a gift from Hanumanji so that others can gain from it. You know, I'm a servant to Hanumanji. That's all. And my job is to serve him by helping as many people as I can. So
Sure, sir. Thank
when
you.
you will be able to breathe better, to me it will bring a great sense of satisfaction and joy. Okay. Anybody else? Any other question? Any doubt about anything so far? Let's go on to the third part of the Swaskosh Shuddhi Kriya. The first part is the huffing technique. Huffing technique has three parts. First is just the huffing, 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 huffing repeatedly, right? Without inhaling, huffing, 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 and then you do the squeezes along the front. Start in the lower part, in the upper part of your belly, which is the lower lungs area, more or less, and then bring it higher, bring it higher. Similarly, in the third part, you do the squeezes along the back. So you do the lower lungs and move it higher. As you continue doing this, phlegm, etc., tends to move up towards the throat area, which you gargle and you throw out. So are you gargling every day, all of you?
Yeah, I'm doing.
Yes, excellent. Very good. Tell me, are you seeing improvements? Breathe, like Deepika ji says, she's breathing better. Are you noticing that your breathing is becoming a little better than before? Hmm? Are you noticing that, Shija ji? Yes. Okay. Okay. Very good. Yeah. So some of the others will also notice that, and that's wonderful. Right. Now we come to the third part of the program, which is the Anulom Vilom. You know what Anulom Vilom is? Geeta ji says belly breathing can be done after having food. Yes, belly breathing can be done anytime. It can be done every time. It should be done anytime. It should be done every time. The more you are able to belly breathe, that means the more your system is relaxed. If your system is relaxed, you are in the parasympathetic nervous system. A little bit of vasodilation is also happening in your system. But as we go deeper, you'll find other techniques to get even more vasodilation and the benefit of that. Any questions so far? Indu Mamiji, are you okay? Are you able to hear me, understand?
हाँ हाँ हाँ
जी ठीक है.
बेली
और
ब्रीदिंग कर रही हूँ अभी बैठे बैठे.
ब्रीदिंग कर रही है, बहुत अच्छा. बागला जी, सरोज बागला जी. Where did she go? Bagla ji is gone. I don't see Bagla ji. Oh, there she is. Avyay Bagla. Avyay Bagla. Saroj bhai, can you hear me? कैसी हो रही है पवन बाबू की ब्रीदिंग? Okay, we'll see if the answer comes later. Doesn't matter. Right. So now we do the third part of the technique, which is with Anulom Vilom. In Anulom Vilom, we begin by using the thumb to block the right nostril. And we use the ring finger, thumb, index finger, middle finger, ring finger, little finger. We use the ring finger. We use the ring finger to block the left and the thumb to block the right. So either one is blocked. Both are not blocked together. Then we can't breathe. So if the right is blocked, left is open. If the left is blocked, right is open. Okay, are we clear? Either of these. Yeah, Saroj bhai, I was asking, कैसा पवन बाबू का कैसा हो रहा है? Is he breathing better? Is he throwing out a little phlegm? So let's begin by first blocking the right with the thumb. Exhale with the left. Let your breath come out of the left. Deepika ji करिए. Block the right with the thumb. Exhale, बाहर सांस छोड़िए with the left. फिर लेफ्ट से सांस लीजिए. लेफ्ट को ब्लॉक करके राइट से छोड़िए. फिर राइट से
इसके
लीजिए.
साथ भी बेली बेली ब्रीदिंग कर सकते हैं ना इसके
जी
साथ?
हाँ, जी हाँ, जी हाँ, करिए, बिल्कुल करिए. राइट को ब्लॉक करके लेफ्ट से छोड़िए. तीन चार बार करिए. फर्स्ट थिंग रिमेंबर, स्टार्ट बाय एक्सेलिंग विद द लेफ्ट. जिससे एक्सेल करते हैं उसी से लेंगे सांस. फर्स्ट वी एक्सेल, देन वी इनहेल. जिस तरफ से इनहेल किया उसके दूसरे तरफ से छोड़ेंगे. इफ यू इनहेल विद द लेफ्ट, वी एक्सेल विद द राइट. इफ यू इनहेल विद द राइट, वी एक्सेल विद द लेफ्ट. फर्स्ट एक्सेल, देन इनहेल. चलिए करिए. राइट ब्लॉक, लेफ्ट एक्सेल, लेफ्ट इनहेल, right exhale, right inhale, block, left exhale, left inhale, block, right exhale. Right inhale, block, left exhale. जितना रिलैक्स होके करेंगे with belly breathing, the better results. So do this 3-4 times more so that you understand the rhythm. Then I will tell you how to do the Swaskosh technique with this. अभी 2-3 बार करिए इसको। सरोज भाई आप बोल रहे नहीं हो तो मेरे को समझ में नहीं आ रहा, दैट वरीज मी बिकॉज आई वांट टू सी व्हाट पवन बाबू इज डूइंग। यू नीड टू रिस्पॉन्ड सरोज भाई, because you are the one who is helping Pawan Babu with his breath in his presence. So I need to communicate with you, Saroj Bhai. Please turn on your videos kindly. Requesting for the umpteenth time. Turn on your videos. I
मेरा
need to
कुछ
be able.
गड़बड़ है,
आपका गड़बड़ है,
या
तब तो
कुछ
उपाय नहीं है
गड़बड़
जी।
हो रहा है।
जी तब तो उपाय नहीं है जी।
No, then
Yes. Please turn on it because it's good to see what you are doing. Then I'll be able to guide, कि आप कर रहे। I need to see whether you are doing it also or not. क्योंकि खाली सुनने से नहीं होगा, करने से होगा। कल्पना जी खाली सुनने से नहीं होगा, you have to do। चलिए करिए। Can't hear।
सर मैं कर रही थी, अभी मैंने स्टॉप किया क्योंकि मुझे यहाँ पे थोड़ा सा ऐसे
अच्छा
पेन जैसे महसूस हुआ, इसलिए मैंने स्टॉप किया।
अच्छा अच्छा ठीक। या तो राइट ब्लॉक्ड, एक्सेल करिए विद द लेफ्ट। शीजा जी एक्सेल विद द लेफ्ट, फिर इनहेल विद द लेफ्ट।
Like I'm getting running nose when I do this. Like something
गेटिंग
is
व्हाट?
coming out.
गेटिंग व्हाट?
No, running nose, kind of some, it's coming from my nose.
So that means something has to come out. Let it come. Clear it. निकालिए। Keep a handkerchief.
Yeah,
Clear
yeah,
it.
I have it.
Clear it. Now, the Swaskosh element, when we exhale with the left, first exhale, पूरा exhale किया, पूरा हो गया, wait करिए, don't inhale, wait, exhale again, wait करिए, don't inhale, exhale a little more, then inhale with left. Block the left, exhale with the right. एक बार पूरा छोड़िए, फिर breathe मत करिए, पूरा चला गया, wait a moment, exhale a little more, wait, exhale a little more, inhale, block the right, exhale with the left, पूरा जाएगा, चला गया, वेट करिए, विदाउट इनहेलिंग, एक्सेल अगेन, वेट करिए, फिर एक्सेल करिए, इनहेल, लेफ्ट ब्लॉक करिए, राइट से एक्सेल, all exhale with the right, wait, exhale more, wait, exhale more, inhale, block the right, exhale with the left, again 3-4 times, as many times as your body allows, but do a full exhale every time, wait, exhale, wait, exhale again. So this is the basic Swaskosh technique with Anulom Vilom, right? Very basic. ये जब होना शुरू हो जाएगा, then we get to the operative part, जिससे real deep cleansing होनी शुरू होती है. Now, as you do the exhale with the left, allow the first exhale. With the second exhale, squeeze along the front. लोअर लंग्स में, पेट की तरफ पे थोड़ा स्क्वीज करिए, वेट करिए, फिर से एक बार एक्सेल करिए, स्क्वीज करिए, वेट करिए, फिर से स्क्वीज करिए, इनहेल, पूरा इनहेल, देन एक्सेल विद द राइट, वही 3-4 बार स्क्वीज करके, स्क्वीज अलोंग द फ्रंट। राजकुमार जी करिए, स्क्वीज, So this is again the second part of the Anulom Vilom technique for Swaskosh Shuddhi Kriya. Swaskosh Shuddhi Kriya is the first part of the Tridosha balancing, where the focus is on expelling, throwing out phlegm from the system. Excessive phlegm हो गया, उसको निकालना, जितना निकाल सकते निकालना. तो ये अभी निकालने का प्रोसेस चल रहा है. Next wala process, starting from the next day's program, will be on reducing the amount of phlegm being created in our respiratory system. And you will see those results over time. तो अभी इसको करना है. इसका सेकेंड पार्ट हुआ. अच्छे से करिए, 3-4 बार करिए. डू इट ऑन योर ओन. डोंट वेट फॉर मी टू प्रॉम्प्ट. अपने आप करिए, मेरे लिए वेट मत करिए. समझिए, प्रश्न है. इफ समथिंग इज नॉट क्लियर, प्लीज आस्क मी एंड आई विल आंसर. So you exhale with a squeeze along the front. Different part of your lungs. You can bring, if you, जैसे भी थोड़ी देर पहले कल्पना जी बोल रही थी, कहीं पर उनको लग रहा है कि देयर इज सम बिल्डअप ऑफ फ्लेम या कफ है. जिस पार्ट में लग रहा है वहां पे थोड़ा ज्यादा स्क्वीज कर लीजिए. योर बॉडी इज स्क्वीजिंग इटसेल्फ. कोई यूजुअली परेशानी नहीं होती है. एक्सेसिव स्क्वीजिंग नहीं करना है, रीजनेबल स्क्वीज करना है. And the squeeze has to be increased. You know, the intensity has to be increased slowly, little by little, not too much in one day. Little by little we increase. सरोज भाई, आप हाँ जवाब तो नहीं देते हो, फिर भी मैं पूछ तो लेता हूँ. हो रहा है, ठीक से हो रहा है? पवन बाबू का ठीक से हो रहा है? जवाब दे तो बहुत अच्छा होगा. चलिए, इसको 3-4 बार करिए एंड ऑब्जर्व.
सर
जी बोलिए, बोलिए, बोलिए. आवाज नहीं आ रही है. अनम्यूट करिए, फिर बोलिए. हाँ वंदना जी बोलिए. हेलो. आवाज नहीं आ रही है. म्यूट हो गए शायद आप. यू हैव टू अनम्यूट. प्लीज अनम्यूट एंड स्पीक. हाँ वंदना जी.
चैट में लिखा है सर.
हाँ सर.
चैट, इन चैट.
अच्छा, देखता हूँ. नहीं, चैट में तो कुछ नहीं है. ओह, हाउ मेनी टाइम्स कैन वी डू अनुलोम विलोम? या सब बाकी सब की तरह इन्हें भी 4-5 बार कर लीजिए. 4-5 बार शुरू में विदाउट डूइंग एनीथिंग, रिपीट एक्सेल. सेकेंड साइकिल में 4-5 बार विद द स्क्वीज अलोंग द फ्रंट. राइट, 4-5 बार, 4-5 साइकिल. एक बार में किया एक्सेल, स्क्वीज किया, वेट किया, फिर से एक्सेल विद द स्क्वीज, फिर से एक्सेल विद द स्क्वीज. खाली स्क्वीज कहां कर रहे हैं, वो जगह को चेंज करिए. लोअर लोअर बेली या बेली के एरिया से कर रहे हैं, फिर थोड़ा आप लो अपर चेस्ट में आ जाइए, मिडिल चेस्ट में, अपर चेस्ट में आ जाइए, एंड सो ऑन. Why do we have to exhale, repeat exhale, and why not one? Because ये system है इसका, MPG, member of parliament जी, because this is what the system is. The why is this gives you better results, like we have been doing in the earlier part of the program, in the huffing technique and the complete yogic breath. That is why. I hope that is clear. All right. हो गया, 4-5 बार हो गया. Squeeze along the front. Done. Now, like you were doing in the earlier state, in the earlier part, you will squeeze along the back. Now, इसका best result तो तब मिलता है when we squeeze along the back, along the chakra points. तो यानी कि पहले मूलाधार चक्र के पास का जो टेलबोन के एरिया, वहां पे स्क्वीज किया. फिर उससे थोड़ा सा ऊपर स्वादिष्टान के एरिया, उसमें स्क्वीज किया. फिर थर्ड पॉइंट मणिपुरा, उस एरिया में स्क्वीज किया. बट सिंस वी कैन नॉट डू सो मेनी टाइम्स, इनिशियली स्टार्ट बाय डूइंग स्क्वीज इन द लोअर बैक एरिया, then lower and middle back or slightly higher. देन इंक्लूडिंग दैट स्लाइटली हायर, पूरा का पूरा एक साथ में स्क्वीज किया, उस तरह से करेंगे आप। आर वी क्लियर? प्रश्न है कोई? समझ गए? ब्लॉक द राइट, एक्सहेल विद द लेफ्ट, और अलोंग द बैक, लोअर बैक की तरफ में स्क्वीज करिए। वेट, स्क्वीज देयर एंड हायर, वेट, स्टिल हायर, inhale, block the left, exhale with the right. Squeeze at the back, lower part, then middle part, then higher and more. Inhale. Exhale with the left. Then squeeze along the lower back. And then slightly higher and more. तो इसको यदि चक्रा पॉइंट्स के हिसाब से करें तो, फॉर एग्जाम्पल, इफ आई से 1, दैट इज योर मूलाधार एरिया, टेल बोन एरिया. व्हेन आई से 2, और दैट इज, व्हेन आई से 1 and 2, दैट मींस मूलाधार एंड स्वादिष्ठान. व्हेन आई से 1 2 3, मूलाधार, स्वादिष्ठान, मणिपुरा. इस तरह से करेंगे और भी अच्छा रिजल्ट मिलेगा, और चक्रों की क्लेंजिंग भी होगी उसमें. सो देयरफॉर लेट्स ट्राई इट विद दैट. एक्सहेल विद द लेफ्ट and then squeeze at point 1, Mooladhar, along the back. Then 1 2, 1 2 3, 1 2 3 4, 1 2 3 4 5. Inhale. Exhale with the right. Then squeeze at 1. Then 1 2, 1 2 3, 1 2 3 4, 1 2 3 4 5. Inhale. Exhale with the left. Squeeze at 1. 1 2, 1 2 3, 1 2 3 4, 1 2 3 4 5. In. ये साइकिल करिए 4 5 बार, अपने आप करिए, डोंट वेट फॉर मी, कंटिन्यू डूइंग इट. यू विल नोटिस योर ब्रीदिंग इज सो मच फ्रीयर ऑलरेडी. करिए एक बार, जस्ट डू 4 5 साइकिल्स. सर, कैन वी डू दिस while lying in disease condition? Depends on what disease condition. If your body allows it, you can do it, but I would prefer you to do it sitting down, because उसमें breathing अच्छी होती है.
How long should we hold the breath?
Not, you don't have to hold it long. Just जैसे एक बार एक्सहेल किया, वेट आधा, 1 सेकंड 2 सेकंड वेट करिए, देन रिपीट द एक्सहेल अगेन, वेट 1 or 2 seconds, एक्सहेल अगेन.
Okay.
कैसे हो रहा है अभी? कैसे हो रहा है बागला जी का? ठीक हो पा रहा है?
He's trying. He's trying. I'm trying. I'm trying.
ओके ओके, वेरी गुड.
Hold on. Hold on. Hold on.
होएगा, वेरी गुड, एक्सीलेंट.
I'm just doing to encourage him. I'm also doing
जी
just to encourage him.
जी. पूरा 5 बार का साइकिल करेंगे, यू विल सी दैट द क्वालिटी ऑफ योर ब्रेथ फील्स बेटर, even better than before.
Thank you.
G, noticing anything? Feeling the breath is better, easier, smoother. G Kumkum G.
Feeling much freer and longer deep breaths are coming.
Yeah, yes. So it's very cleansing and the breath feels much, much freer, smoother,
And
lighter.
I experience a lot of congestion on my right side.
हाँ, ये जैसे जैसे अपन डीपर जाएंगे ना इन द हनुमान मास्टर ब्रेथ एंड द लोटस ओपनिंग दिस congestion will free up because as the congestion frees up your sushumna will flow more.
Right.
As long as you feel the congestion sushumna will be less active.
That's why because मेरा ये कफा predominant है,
जी
साइनस वगैरह और कफ वगैरह रहता है,
जी
so the heat in my body is not enough.
Yes. So in the next part of the program, that is what we will do. I will show you techniques to build heat in the body as well.
Right.
And then continue along with the lotus opening and the Hanuman master breath, you will start getting very good results. Again, slow results, so we must not build up expectations. We have to go a little patiently with the thing.
Makes clarity. If you do it, you will find it.
Yes. राइट शीजा जी आप कर रहे नहीं हो देखने से नहीं होगा
Actually, sir, my right is fully blocked now. Like
fully blocked
one
you are not
nostril. Yeah.
so the
No, it's
techniques
there, but it's getting blocked when I do it.
no but when you do the Swaskosh Shuddhi Kriya huffing technique complete yogic breath it does not open
No.
it should open if you
No,
do
that
your
time I did not have that problem. Only this time I'm just having one side block. I don't know why.
okay so do a little
Last
bit of
time I'm
huff
able to do it. Mhm.
doesn't matter do a little huffing technique see if that opens up a little more and then do it this is a very powerful very useful breathing technique very quickly you will feel an improvement in the quality of your breath. Very, like Kumkum ji just reported, she's seeing an improvement immediately. You will also see that improvement. Yes, anybody else? Deepika ji, noticing any change?
Yes, sir. When we are exhaling, so we have to exhale in breaks now.
No, we don't have to exhale in breaks. Your first exhale is a full exhale. Then you
Okay,
wait.
first.
Then a little more exhale. So it's not as if
Okay,
it's not like we are breaking the exhale.
breaking.
The exhale is
Okay, okay,
no, it's a full exhale.
okay,
We wait, but then a little more exhale can be done. Then we wait, a little more exhale becomes possible. So if we say break, that means we are not doing a full exhale. That's not okay. We want a full exhale.
okay.
Hmm.
And after full exhale,
We
we
wait.
should close
Wait a
our
moment.
mouth also. है ना?
Yes.
We should not
Yes.
open our mouth.
No, no need to open the mouth. So we
Thank you.
wait a moment, exhale again. Yes. राजकुमार जी, आज कफ नहीं निकल रहा आपका? यू नॉट एक्सपेलिंग फ्लेम टुडे, राजकुमार जी? कमिंग आउट? How is your breath different? Is your breath feeling easier? Better? Feeling better? Very good. Okay, very good. Anyone else? Narpati ji, seeing a change in your breath? No, silent. Can't hear you. No, no, no. You are muted. And yeah,
No,
yeah,
it is
now.
okay. Yeah. Yes, it is much more freer.
Freer. Yeah,
I feel
very good.
yeah.
Yeah, very good. Excellent. Rajkumar ji, freer? Breath feels freer?
Yes, sir. My breathing is clear. You can come out.
Very good.
My nostrils clear.
Okay. Saroj bhai, Pavan Babu noticing an improvement in the breath also?
No, not now. Maybe.
Not now. Kar pa rahe?
Not now.
Are you able to do it?
Yeah, I am able to do it. But you can't
Okay.
do that squeezing of the spine. You can't do.
Okay.
It's
So
not
please
very-
let him start that a little by little.
Yeah, I'll do that. The
Yeah.
Anulom Vilom we can start doing. And the
Yes.
huffing and between the huffing
Yes.
and the belly breathing.
Yes.
I'm doing that.
Okay. Okay.
हो जाएगा.
हो जाएगा, right? Okay. Yeah.
Yeah,
इंदु मामी जी, आपका हो रहा है? ब्रेथ में फर्क आ रहा है कुछ? इंदु मामी जी? Okay. Kalpana ji, noticing a change?
यस सर, लाइटर लग रहा है मुझे
Lighter
ब्रीथिंग
लग
करते वक्त अभी.
Yes.
Yeah.
So now that you have understood how it is useful, you must do it regularly. You must do it regularly, continue to take advantage of it. And then, of course, yadi, how many of you are joining the advanced course? Are you joining the advanced course? Rajkumar ji, Kalpana ji,
Yeah,
Shija ji,
I'll do.
Narapati ji, very good. Yeah. What about the others? Are you joining the advanced course?
Yes,
Yes,
Raju
yes,
sir,
yes,
very
sir.
good. Saroj bhai, very good. Deepika ji, excellent. Yes, very good. Yeah. Yeah, very good. Do it, notice the difference, but practices must be done on a regular basis. That is important. जो join कर रहे हैं, I have shared details on how you can make a contribution. I have shared it in the group. यदि कोई, if you have any questions, send me a message directly. I think I'll write down my number here, WhatsApp number.
Yeah, kindly repeat the number.
I'll send you my number. Yes, one second.
Yes, sir. That would be useful, sir.
Yeah,
Sometimes it's very difficult.
I'm sending my number, but I've also sent all details of the Rajyogi Power of Breath Foundation. I've sent the details, but if you still need anything, any other information, you can ask me, no problem. If you can make a contribution directly to the Rajyogi Power of Breath Foundation, excellent. If for any reason that's not happening, send me a message. and then maybe you'll find another way to do it. But yes, do it. How much you are able to contribute, how much you are willing to contribute depends on you. There is no pressure. If you are generous, it helps the process, because we can do the next program again in a month or 2 months time. More and more people need to be touched. If you share how you are benefiting, how your breathing is improving, if you share it in the group, if you share it in your other groups, it can help more people connect and to take advantage. You know, there are many kinds of charity. Some people give food, some people give something else, and so on. But there are very few who can help other people breathe better. So the Rajyogi Power of Breath Foundation is focused on helping people breathe better. So you, by joining with this in any way, by doing donations, by contributing, by sharing this information, by telling other people about it, you can make a difference. The more people we are able to help to breathe better, the more we will be. I think karma will also notice that they've done something good. They've done a little good karma. You believe in karma, yes or no? Hmm?
Yeah, I
Yes.
think this is
You believe in
fundamental.
good
Yes.
karma. Yes. So we want to
Definitely.
continue. Yes. So we want to do good karma. This is also a way of doing a little bit of good karma. I will do what I can, but if you all also help, it becomes easier. That's it. All right. Any questions so far? Anybody, any questions so far? Hmm?
But, will you upload it in YouTube, today's session?
Yeah, today's session I will upload. Yes. Have I started recording or not? Yes, yes. Yes, I recorded. Yes, Shijaji, what is on your mind? You seem to be thinking something. No?
So like I feel better in terms of like I used to do mouth breathing a lot.
Oh,
After these 3 days, I am
hmm.
able to do it through my nose.
That's very
I've
good.
started observing that difference because it's not
Hmm.
during the night. Over the day also, I used to do mouth breathing.
That is not
Automatically,
good.
my nose will get black. Yeah, but now
Yeah,
it's getting better. So
yeah.
yeah,
That's
that's
one.
what I just
You
want
should
to.
share. You should share your
Mhm.
experiences in the group
Yeah, yeah,
also.
I'll do that.
All of you
Mm-hmm.
should, whatever changes, Deepika ji, you are noticing changes, you're breathing better, etc. Share it in
Yes,
the
sir.
group
Sure.
so that Mr. Rajkumar, share it in the group so other people know that you are benefiting, how you are benefiting. You can inspire others. So, do this. Usha Kannan ji, you have been very quiet. Geeta ji, also, you've been very quiet. Manshi ji, Tejaswini ji. Tell us what is happening. Kalpana ji, what is happening? Rajshri ji, are you noticing changes, any improvements? Talk about your experience, share your experience, inspire others.
फ्रेश लग रहा है सर
फ्रेश
बहुत
लग रहा है तो आपको क्या पहले क्या प्रॉब्लम थी ब्रीदिंग में राजश्री जी?
मुझे खाली लेफ्ट साइड का कुछ ये लेने के लिए तकलीफ होता था लेकिन अभी अच्छा लग रहा है
तो ये सब शेयर करें, कृपया शेयर करिए ग्रुप में, बताइए दूसरों को कि आपको ये इम्प्रूवमेंट मिला है, क्योंकि कई बार लोग वेट करते हैं कि दूसरे को कुछ होगा तब मैं करूंगा। तो यू कैन इंस्पायर देम। यस, वेरी गुड राजकुमार जी, आपका तो बहुत फ्लेम निकला, मैंने देखा, बहुत फ्लेम निकला। एक्सेलेंट। सो यू विल नोटिस अ वेरी ग्रेट इंप्रूवमेंट इन द क्वालिटी ऑफ योर ब्रेथ, बिग चेंज यू विल नोटिस। वेरी गुड। दीपिका जी, फीलिंग बेटर ऑलरेडी?
Yes, sir. I'm feeling better. My phlegm is
Hmm,
also coming out.
that's
That's
wonderful.
why. Yeah.
Excellent. So good to know. Very good. So good to
I
see
really
this.
want to be healthy now. That's
Yeah,
why.
you and Deepika ji, we will make you healthy. Okay,
Yeah.
you will do the work, but we will be there to help you, guide you, support you, encourage you. Okay, don't feel
क्योंकि exhaling while I'm exhaling, so I can exhale till third only. Fourth, fifth, I
doesn't matter.
can't.
Today it
That's
is
why.
third.
Fifth,
After a
yeah.
week, after 10 days, it may be fourth. So don't worry, it'll
Hmm.
increase. है ना?
Why I'm not putting pressure on
Don't
myself.
put
You
pressure. Abhi
told
don't
me
put
don't
pressure.
pressure.
No, Abhi,
Oh,
no, put a little pressure. That's it. Just a
little bit.
gentle pressure. and
Yes,
slowly over time increase that, because as we put that pressure, we do a little stronger squeeze on the system, and that helps to move anything that has to be moved and removed. Very good. I've shared my number here in case you do not have my number. I've shared it. You can send
okay.
me a
I
message.
will check that.
You can
Yes.
ask to join. You can join the Tridosha Balancing group. You can also ask to join the advanced group, for the advanced techniques. So today, if you can all join today, then we can have this advanced session tomorrow. If you do not join the group today, then maybe we will do the advanced session one day later. So try to join today so that we can save time and start with the process, and then maybe we can do it 2 days to get you a little more uh, uh, aware or practiced in the technique so that you get excellent results. Ji. Very good. So I'm adding Pavan Baglaji's name also to the advanced practice. Okay, very good. Share. Whoever is joining, send me a message in the group that you wish to join the Tridosha Balancing Advanced group. You know what to do. I've shared the details, the bank details of Rajyogi Power Foundation, Power Breath Foundation, and we'll meet again, hopefully tomorrow. Otherwise, also day after tomorrow. Any questions, anybody?
Sir,
Anyone,
then
any
what
question?
about Pitta and Vata and Pitta
Very good.
balancing?
Very good. Since this program is primarily focused on Kapha, we will continue with that focus. Indirect benefit will come for Pitta and Vata also. You will notice very often if one dosha is controlled, it has an indirect effect on the other doshas as well. In the future sessions, over time, we will try to do a session for other doshas more specifically. This particular course is more focused on the Kapha dosha. So that is where
Kapha
our
only.
focus will continue to be. Indirect
Oh,
benefits you will get for Vata and Pitta as well.
Pitta.
But tell me, as we continue doing it, let me know what is your problem or what is your dosha, which aspect, so I can tell you how to change your practice a little if needed, if necessary, if any change has to be made to your practice.
Just now I'm suffering with Vata dosha.
We will
So
cure,
tell me
we will
something
work on
about.
that. Yeah, we will work on that. But like I said, for now, focus is Kapha for the present. आपका कफ निकल रहा है कि नहीं? कल्पना जी, आर यू एक्सपेलिंग कफ
मुझे
और
कफ
नॉट?
नहीं है सर, कफ का
एकदम नहीं
नहीं है
है?
मुझे कुछ इशू ज्यादा।
एक
नहीं
अधिक नहीं है कि कुछ नहीं है?
नहीं, थोड़ा बहुत है, सुबह जब
हाँ,
हम ये करते हैं तब उतना
हाँ,
निकल जाता है, बाकी कुछ नहीं है।
नो
फिर
बिकॉज
वात का ही सिर्फ मेरा ये ध्यान फिर वहां पे जाता है, बार बार जो फेस का ऐसे स्क्वीज हो रहा है तो
नहीं
उसके
नहीं,
ऊपर
वो तो
मेरा फिर
लोटस,
कंसंट्रेशन उधर चला जाता है।
वो लोटस ओपनिंग से आपको बेनिफिट मिलेगा. So you know that
ओके
lotus
ओके,
opening will bring
थैंक यू
bring
सर।
you very good results. Yes.
ये
ठीक है. Once the sessions are
ओके
completed, typically how much time would practice on? See, MP, it depends on you. I will share the technique. How much you are able to do is going to be dependent on you. If you are, some of these practices are very simple. आप आराम से डेली के हिसाब से कर सकते हैं, उसको आराम से कर सकते हैं. So do it. How does it matter whether you are breathing in the old way or in a new way? If you continue to breathe in the new way, if it is bringing you good results, continue doing it. Like earlier, you were not doing belly breathing. Now, if you are doing belly breathing throughout the day, you don't have to make an extra effort. It's not taking anything away from you. It's only adding to your experience. So continue doing that. Gee, anything else? Shall we wrap up for today?
Yeah.
Thank
That's
you.
it.
Thank you. Thank you so much. See you again
Yeah.
tomorrow, day after.
Thank you, sir.
And then we
थैंक यू
continue
सर,
with the advance.
थैंक यू।
Thank you. Share your
Thank you, sir.
experiences, please. Thank you.
Thank you, sir.
Thank you. And namaste.
Thank
Share
you.
your experiences. Yes. Namaste.
Thank you, sir.
Gee.